Welcome to today's episode of Health Matters. I'm Dr. Emma Richards, a specialist in chronic conditions affecting women. Today, we're discussing a condition that's often misdiagnosed or overlooked entirely, lipedema. We'll be exploring the hidden costs of untreated lipedema, physically, emotionally, and financially.
Hello, everyone. I'm Dr. Michael Bennett. I'm delighted to join Dr. Richards today to shed light on lipedema, a chronic disorder that primarily affects women. It's characterized by abnormal fat deposits in the lower extremities that can cause significant pain and mobility issues. And unfortunately, many women suffer in silence because they don't know what's happening to their bodies.
That's absolutely right, Michael. Many patients come to me after years, sometimes decades, of being told they just need to diet harder or exercise more. But lipedema fat does not respond to traditional weight loss methods, which leads to enormous frustration and self-blame. The physical toll is significant. Painful, swollen limbs that can eventually lead to limited mobility.
And it's progressive if left untreated. In early stages, patients might notice disproportionate fat accumulation in the legs and sometimes arms, while their upper body remains relatively normal. As it advances, the skin becomes uneven with indentations, and patients experience more pain and tenderness in the affected areas.
In later stages, we see large protrusions of fatty tissue causing deformities, especially around the knees and thighs. Some patients eventually develop lipolymphedema, where both lipedema and lymphedema are present. This can significantly impact joint health, making movement extremely painful. Many patients report difficulty walking or standing for extended periods.
The physical symptoms are just the beginning, Emma. The emotional toll is devastating for many women. Can you speak to that aspect?
Absolutely. The psychological impact of lipedema is profound and often overlooked. Many women experience severe body image issues because their body shape doesn't match societal norms. They face stigma and judgment, with people assuming they're simply not trying hard enough to lose weight. This leads to feelings of shame, embarrassment, and isolation.
Studies have shown that women with lipedema have higher rates of anxiety and depression. The chronic pain and progressive nature of the condition can lead to feelings of hopelessness. Many report avoiding social situations or activities they once enjoyed because of discomfort or embarrassment about their appearance.
I've had patients tell me they've stopped going to family gatherings, quit hobbies they love, and even turned down professional opportunities because of how lipedema affects their self-esteem and comfort in public spaces. The emotional burden can impact relationships, career advancement, and overall quality of life.
And we haven't even touched on the financial aspects yet, Emma. The costs of untreated lipedema extend beyond the physical and emotional realms, don't they?
They absolutely do. The financial burden of lipedema can be substantial. Without proper diagnosis and treatment, many women go through years of ineffective interventions, diet programs, personal trainers, supplements, all while their condition worsens. These out-of-pocket expenses add up quickly.
And when symptoms progress, there are costs associated with pain management, mobility aids, specialized clothing, and compression garments. Some patients need to modify their homes or vehicles to accommodate mobility challenges. Others may need to reduce work hours or even leave their jobs entirely if the pain and mobility issues become severe enough.
That's right. And while we're discussing financial impact, we should address the insurance challenges. Many insurance companies still consider treatments like specialized liposuction for lipedema to be cosmetic rather than medically necessary, despite growing evidence to the contrary.
The numbers are quite staggering. The cost of lipedema surgery can range anywhere from $20,000 to over $65,000, depending on the location and stage of the disease. And that doesn't include compression garments, which can cost $300 to $800, lymphatic drainage therapy at $100 to $200 per session, or physical therapy at $150 to $300 per session.
And time off work for recovery adds another financial strain. Most patients need 2 to 4 weeks off work, with some needing more time if they have physically demanding jobs. Without insurance coverage, these costs can be prohibitive for many women who desperately need treatment.
It's a perfect storm of challenges: physical pain and limitation, emotional distress, and financial burden. But it's important to emphasize that there is hope. Early diagnosis and appropriate treatment can prevent progression and significantly improve quality of life.
Absolutely. Education and awareness are crucial first steps. If you suspect you might have lipedema, if you have disproportionate fat in your legs or arms that doesn't respond to diet and exercise, pain or tenderness in these areas, or easy bruising, please seek evaluation from a healthcare provider familiar with this condition.
For our listeners who want to learn more about lipedema or who suspect they might have this condition, there's a fantastic resource available. The website liposuctionforlipedema.com offers evidence-based information in plain, accessible language. They've created a judgment-free space specifically designed to support women dealing with this challenging condition.
What I appreciate about their approach is the focus on education and support. The site offers articles, symptom checklists, and diagnosis guides to help women better understand what they're experiencing. And I understand they have a new feature that I'm particularly excited about.
Yes, they've introduced an AI digital assistant that can answer questions about lipedema symptoms, treatment options, and more. It's an incredible tool for women who might be just beginning to research their symptoms, or those who have questions they might feel uncomfortable asking in person.
And most importantly, the site can connect women with specialized healthcare providers who understand lipedema. They offer free consultations with doctors experienced in treating this condition, which is invaluable since finding knowledgeable providers can be one of the biggest hurdles for patients.
I would strongly encourage anyone experiencing symptoms consistent with lipedema to visit liposuctionforlipedema.com and schedule that free consultation. Early intervention can make an enormous difference in outcomes and quality of life.
Remember, you don't have to suffer in silence or accept that pain and progressive swelling are just normal parts of aging or weight gain. Lipedema is a real medical condition that requires proper diagnosis and treatment. Taking that first step towards getting answers can be life-changing.
Thank you, Dr. Richards, for this important conversation today. I hope our listeners have gained valuable insights about lipedema and the critical importance of early diagnosis and treatment.
Thank you, Dr. Bennett. And to our listeners, thank you for joining us. Visit liposuctionforlipedema.com to speak with their AI assistant and book your free consultation today. Remember, knowledge is power, especially when it comes to your health. Until next time, this is Dr. Emma Richards for Health Matters.